Hello people, in this video let us look at this medical pharmacology book, 7th edition by Padmaja, Udaykumar. This is, they're saying is a textbook type of book, right? However, the actual book that you have to read is K.D. Tripathi. So what you can do is look at these books, read and then underline the statements in K.D. Tripathi and then continue to read K.D. Tripathi. That would be better. Let's look at inside of this book now. So look at the contents. Oh, a lot of contents. So basically you have general pharmacology, you have pharmacokinetics, which have then pharmacodynamics, then you have the ADR, pharmacovigilance, autonomic nervous system where you have the adrenaline, noradrenaline, then cholinergic, anticholinergic drug. Cholinergic drug, name some quickly. It's neostigmine. Then you have pilocarpine, and then you have for cholinergic drugs acetylcholine itself, which they don't give because it is very fastly metabolized by the body, right? Then autocoids. This is what I meant that I'm autocoids. So you have here you have all the histamine, antihistamine, your citrazine, etc. Right? Then what else? Focus, guys. We are looking at this book, Medical Pharmacology by Padmaja Udaykumar. So we're looking at the contents here. Anesthetics, so local anesthetics, general anesthetics. So here you should know about halothane, right? And all those that they're using in your hospital. Go and look at what anesthetic they are giving. Then you have these central nervous system acting drugs. You have the anti-epileptics, right? Then you have the antipsychotics. So you should know all that. Then drugs acting on kidney, diuretics, antidiuretics, right? See, wait, antifibrinolytic tranexamic acid, antiplatelet clopidogrel, okay? Anticoagulant will be your warfarin and all that, okay? Heparin, warfarin. Then cardiovascular system, ACE inhibitors, ARBs, angiotensin receptor blockers, calcium channel blockers, okay? So I think we're looking too much into the content itself, right? So there are other classification of drugs, respiratory system drugs, GIT drugs like we told you about, proton pump inhibitors, right? Mainly your omeprazole, pantoprazole, etc. Then what is this? Drugs used in endocrine disorders. Like they'll give thyroid hormone. So many people in India will be taking Eltroxin, which is the brand name. Actually, it is nothing but thyroxin, right? Then you should know the exact MCG, I think, that they will be taking. Every day morning they'll be taking before breakfast. Corticosteroids. Then chemotherapy. So chemotherapy also should know a lot of drugs, guys. Chemotherapy includes your cancer drugs and it causes also your antibiotics, okay? Everything it includes. Antimicrobial drugs. So that is chelating agent, desferrioxamine for iron, then you have D-pencilamine for copper, etc., right? So general anesthetics, guys, focus here: ether, halothane, isoflurane, desflurane, sevoflurane. Usually they use this in your IOT. Just go and look at them, okay? So these are inhalational. Intravenous, what do you give? Propofol. Have you seen anybody get propofol? Fentanyl. Fentanyl is they're giving as a painkiller also, opioid analgesic. Look at that, okay? Midazolam they will usually give before small procedures so that the patient will relax. So some diagrams and flow charts also are there here, how they work. So look at this benzodiazepines, okay, like what, diazepam, etc., right? What do? GABA. GABA is a inhibitory neurotransmitter, right? So what is happening here? So they enhance this GABA effect, so there will be CNS depression. So that's how it works. At the end of every chapter, what have they given? Clinical pharmacology. So what will you give if they have sleep onset problems? They'll be calling it as pregabalin, etc. Just check for people who have this neuropathic pain, right? For diabetic, the tingling sensation and all, they'll be giving that pregaba, such things in the night. Just let's look at some tables and some diagrams. Bioavailability of these drugs. Nifedipine is a calcium channel blocker. All the calcium channel blockers, they have given the bioavailability route that you can give and indications. So this route is important because sometimes you have, if you want to discharge the patient, you want to make everything as a tablet. Hypolipidemic drugs. These are the drugs that I need because I have cholesterol very high. Otherwise, no problem, touch wood. So this diagram is nice, no, very clear how lipid transport. So how the lipid, see how they enter the liver, okay. So all this you should know. Intestine they have shown here. I would like it if they show the intestine right here below the liver. It's kind of confusing writing it there above the liver, right? That gives a complete systemic picture, you know, if you put it according to the place it is there in the body. So endocrine disorders, you will have to learn a lot about insulin, thyroid hormone, steroids, all these hormonal, right? What do you think the books looks like, guys? See, by this review, you hardly will know what mistakes are there in this book. So if you want a book which is reliable, then you will have to go for, yes, K.D. Tripathi. These all books, if you are reading, read this and underline in K.D. Tripathi and then continue to read K.D. Tripathi. Okay, that is our suggestion. So this is medical pharmacology book review.